I prepared about 45 slides and all kinds of information, but the truth is that I like to give my presentation based on what it is that you need. And I don't know what you need yet because I haven't mentioned it. So what I'd like to do is to start off by just going around the circle, saying your name, maybe when you made Aliyah, if you'd be willing to, and of course nobody has to. What I like to do when I give a presentation is I like to give everybody an opportunity to say really what do you really need, and hopefully by the end of this session I will give you what it is that you need, and this is something that obviously would require a lot of discussion. But I want each of you to feel, I'm sure you came here for a reason, that you're going to get what it is that you want. Would you like to begin?
Sure.
Very important, thank you. And I'm happy, it's very important because I would say this is especially true for women who are, it's stereotypical and it might be called sexist, but it's the mitziyut, that women, especially of your generation, are raised to be focused on taking care of everybody else. And so you started about your granddaughter, but then you went about yourself. And it's very, very important because one of the ways that people deal with stress and trauma is they dissociate from their own feelings and focus on something else. And that something else might be taking care of somebody else. And so that might be rewarding, and you might be telling yourself, wow, I'm really a good person, I'm doing the right thing. And it's true, you are being a good person and you are doing the right thing. However, you're not taking care of yourself. And as they say in the airplane, put on your own mask before you put on the mask of your child. And it's a very, very important principle. Very, very important principle. So thank you very much. I'm happy that you got to that place. And if you take a look at what enabled you to get to that place, close your eyes a second. Is it all right? You don't have, and by the way, nobody has to do what I ask you to do, okay? Because look, I'm a therapist, okay? And I work with people very, very deeply. And my thing as a therapist is I help people very quickly get to the real issue instead of talking for 5 months and then starting to figure it out, okay? If you want to go there with me, great. If you don't, also great, okay? Close your eyes, put your hand on your heart, go inside of it. Okay, you use the word concern. What's the real word?
Fear.
Okay. Now, I'm going to switch the way I'm working. I'm not going to just go back and forth. I'm going to talk in real time with what you're bringing up, and I'll come back to what we spoke about, okay? Now, open your eyes again. Okay, now. I want you to understand that it's really, really important. And this is for everybody, because we're all dealing with the same dynamics. We have our own individual responses, but we're all dealing with our own dynamics. And with general dynamics. If you think the label that you put on an experience affects and sometimes determines how you're going to relate with it and what you're going to do. If you think what you're experiencing is concern, then you're going to deal with concern. Because you haven't let yourself know that you're really afraid. If you allow yourself to know that you're really afraid, then you'll be able to do what you need to do to deal with the fear. I talk a lot about awareness, relationship, and responsibility. Okay? And I'm going to bring that in right now. If you're aware that it's fear rather than concern, okay? So you have the awareness. Once you have the awareness, then you can relate in the right, real way to what's going on. And responsibility is the ability to respond. So when you have the awareness, and then you have an appropriate relationship, then you have ability to respond in a way that's going to be helpful. So it's very important for each of us, including myself, because I could be, so involved in, let's say, my work with patients or whatever, that I'm not thinking about what's going on with me. It's true for everybody, okay? That it's important to know what's really going on inside, and at the same time, to know how to do it, b'midah u'be'izun, in the right amount, and at the right time, and in a balanced way. Because if you focus in, for instance, on fear, it can trigger things that will then be debilitating, and you won't be able to respond or relate in the right way, or even be aware in the right way. Because we'll talk a little bit later about PTSD, post-traumatic stress syndrome, that there are certain psycho-emotional, biological responses and processes that happen in the body that have all kinds of effects. It's a good thing to know how these things work so that you can have the mastery over what's happening instead of feeling victimized about your feelings. Okay? So once you're aware that you're afraid, don't get stuck in it. Ask yourself, and we're going to talk about it today, what's the right way of relating to fear so you can do something positive and helpful? Specific considerations for Olin. Can somebody read that, please? I was not built, prepared, or trained to relate or cope with war. Okay? You're going to say it again. I was not built, prepared, or trained to relate or cope with war. Okay? Now. Now would be a good time to take a deep breath and relax. How about if we all do that? And we're going to do some guided imagery and relaxation today. Okay? But now's a good time to do that. Because, as we're talking about the stuff that's difficult, the stress level goes up. And we want the sweet being inside this woman to feel good and not to have stress hormones going through your body while you're pregnant. So it's especially important for you because stress hormones, by the way, go through the placenta. And it's very important for you to be able to do meditations and relaxation while you're pregnant. Okay, we can talk about that. You're smiling. Why are you smiling?
That's what I've tried to do.
Huh?
I tried to do that.
Good. Don't try to do it. Just do it. Right? Fritz Perls, the father of Gestalt therapy, said trying is lying. Why? He only said I tried to get to the bus if you missed it, right? You like that? Okay, so take a deep breath. Okay, now, this is a somewhat Jewish thing, the problem that you're raising, because we're always taught, you should be better, you should be better, you should be better. L'chaim, l'chaim is a blessing, but it also is a curse, because you never feel good enough. Okay? And the fact that you would like to be able to be more for this one, and be able to handle this better, etc., okay? You're entitled to have your own feelings, and you're even entitled to have your feelings make it less possible for you to do what you wish you could do. Okay? And everything has its consequences. I'm giving this talk in English. I work as a therapist in Hebrew as well. But I'm sure that I can't be as fluid in Hebrew as I am in English. But that's part of the price you pay for making Aliyah. It reminds me, in 2001, I think it was, I gave my first talk in Israel to teachers, I think in this building. And I was wearing contact lenses and I put drops in it and didn't know, what is that? I said, Yeshli Adashim Beinai. Adashot to contact lenses, Adashim are beams. So everybody laughed at me. Okay? But that's the price that you pay. And one of the prices that you pay is that there are missiles and there are sirens and there are wars. And what's important for you is to remind yourself what Dr. Jeff Jacobson, my neighbor, great radiologist, said to me when I was down on myself for not being more in Israel. He says, Simcha, you accomplished one of your greatest dreams. You made Aliyah. And it's a big thing. And it's very, very important for you to focus on. And to ask the people around you to be mefargeng, to give you support, to give you compliments, and say, how come you're not doing this good enough? How come you're not doing that good enough? Wow, yeah. Okay, so take a deep breath. Close your eyes a second. Put your hand on your heart. Put your hand on your heart. You'll find it.
I don't know.
The reason why you're hurting so much is because you have so much heart that you don't know certain things how to do it. You have a lot of heart. So what I'd like you to do is give yourself permission to let yourself off the hook for not being perfect and not being a person who can fulfill everybody else's needs. And if you're a believer in God, be with God right now and let God give you nourishment. And allow yourself to receive from the ultimate source comfort. Take a deep breath. And of course, I'm speaking to everybody in the room. I'm not just speaking. Everybody should do this. Because everybody has these feelings of not being enough. Because when you make Aliyah, it's impossible to be at the level on all kinds of things that you were doing before you made Aliyah. That's the mitziyut. That's like, if a person has a certain learning disorder, they're given certain advantages in school because they don't know the language or because they're ADD or whatever it is, hakalot. You have to give yourself those hakalot. You have to make it somewhat of a normal playing field. You can't compete with who you wish you could be because nobody's who they wish they could be. Basically, I think that's true. Because we all would like to be better. So let go of some of that pressure that you put on yourself and guilt this stuff. Because getting back to Gestalt therapy, Gestalt therapy says that oftentimes guilt is actually resentment towards someone else that you internalize towards yourself. And instead of feeling resentful towards the people who are laying trips on you or causing you to feel that you're not good enough, you feel guilty because you don't know how to say, hey, I don't want to take that in. That's your issue. If I'm not good enough for you, maybe that's because you need too much. Or you shouldn't be asking everything from me. Does it make sense to what I'm saying?
Yeah.
And I'm not just speaking to you, obviously. I'm speaking to myself and everybody. We did a little sur meirah. There's a pasuk that says sur meirah v'asei tov. Get away from evil and do good. So we talked about getting rid of some of the schmutz. What could you do inside? Close your eyes a moment. Close your eyes a moment.
Oh, okay.
What could you do inside that would put a smile on your face? So go. That was only 10 seconds. Can you think about something you're happy about?
Your cartoons. Well, that's true. I have put a smile on her face.
Okay.
It's true.
She loves her cartoons.
And let the, okay.
It's true.
Okay. And
I
I
love
want
my
you,
cartoons.
okay.
They do.
Good. And I want you now, you were shaking your foot. Shake it on purpose now. You were going like this with your foot. Do it on purpose now. And let the anxiety out.
And shaking a lot.
That's right. Let the anxiety out. And go right out your leg into the floor and make room in your cup for some positive feelings. The cartoons. There you go. You smile. Okay, good. Keep doing it. Let the anxiety and the bad feelings out your foot. And let the cartoons in your head and travel through your body. Everybody needs to find their own medicine. And everybody has medicine. Everybody has all kinds of resources inside that you can discover and use. Okay? Can you think of a particularly good cartoon?
Excuse me?
Can you think of a particularly good cartoon?
About 10, actually.
Oh, good. So now you're laughing. Oh, that's good. Excellent. Yes, I'm going to say something to you that I hope it's okay for me to say to you.
Yeah.
And it's probably good that I'm saying this to you before you go into labor. You said the words, I want to feel the pain.
No, I do feel the pain.
Yeah, but that's not what you said.
Yeah.
I listened to what you say very carefully.
Right.
Okay? And I
want to allow myself to feel the pain. But then when I allow myself to feel the pain, then I become unmobile. I need to deal with my kids and I need to stay healthy with the baby, whatever. I feel that I can't allow myself to feel the pain because when I do, it's immobilizing.
Okay. So, I know a lot about pain. I wrote for the medical magazine Ka'ev in Israel on hypnosis for dealing with pain. And you have to be careful because on the straight subconscious level, you said, I want to feel the pain.
Right.
I'm not going to get into it here and now, okay? But I recommend that you will be very careful how you relate to that. because it reminds me, I worked with a patient in Los Angeles about 25 years ago now, who had back pain, didn't know why, we did hypnosis, and she said, I feel alive when I'm in pain. Without the pain, I feel like I'm not alive. That's what she said. Very, very important to relate to the pain in the right way, and not to utilize it. What I hear is that my intuition tells me when I'm listening to you, is that you're utilizing it in a certain way to connect. You want to be connected, and then you talk about the pain.
Right.
And there are a lot better ways of being connected to life than pain.
Right.
And you may have heard it somewhere, your family growing up, somebody put some kind of juke in your computer in your head, that there's a thing about connection and pain. Oftentimes that happens in families, that they don't know how to connect except to painful dynamics or whatever it is, okay? So what would be helpful for you and for all of us is that if anybody has any kind of what's called secondary gain, benefit that you get, and what you're saying you don't want, regarding pain, figure out what it is and get rid of it. We all have kalim. This is a Kabbalistic concept, but it's also a psychological concept, okay? We all have vessels, okay? There's something called shvirat kalim, that if your vessel isn't strong enough to handle the light, or it could be not light, it could be darkness, or whatever it is, then your kli, your vessel, shatters. So you have to know where your kli is and how strong it is. Sometimes, until you strengthen your kli, then you have to be careful, more careful what you're putting in. It's like hot water. What kind of glass are you putting it in? You put a teaspoon in first, absorb some of the glass, some of the heat. Okay? So there needs to be the right balance about that. And I remember during the Second Lebanese War, I called up the Department of the Ministry of Communication to tell them that certain things that were putting in the news, that we have these things going along the top and along the bottom, these graphics. And I said, what it's doing is it's hypnotizing viewers while you're showing them pictures of the war. It's very unhealthy. Okay? So you have to be very, very careful about media, because they show the same bomb 20 times in 1 minute because they don't have enough content. So they show the same horrible thing over and over again, and they're talking about something that is maybe less disturbing, but subconsciously you keep looking at that image, which of course has an effect on you. So we can be connected with your heart. It's much better than some people get to be obsessive compulsive about the news. They're checking every 2 seconds. I would Shabbat. Okay, I check too often. I'm guilty of that. Okay, because I want to know what's happening. But I'll tell you, much better, instead of my watching the news, that I'm here helping people. So if you want to be connected, find a way of doing something positive, because it'll make you feel better and it'll make other people feel better. It's a win-win situation. And be very, very careful about media. You were talking about media and wanting to know what's going on and not knowing when the end is going to be. And you know something, the truth of the matter is that you don't get the truth in the media anyway. And I was watching, it's not to say Lashon Hara, but it's just true. We were watching Channel 2 news. And we switched to Channel 10 because the Channel 2 news was so aggressive, and the way they spoke about things was so aggressive. I said, who needs to listen to this? Listen to somebody who's speaking more gently about it. What about it? Because you used the word problem, but you didn't say what the problem is. You're hinting at about being emotional. So what's actually the problem? You know something? Close your eyes. Put your hand on your heart. What's the bottom line? What's freaking you out?
Understanding.
So it means lack of control. Is that right? Because we don't understand. Is that correct? Okay. So you're using, and this is one of the responses to trauma, and it's also one of the symptoms sometimes of PTSD, that you try to find meaning, like Viktor Frankl, right? He's trying to find meaning in the Shoah, right? You're trying to find meaning in what's going on here, but it's related. The thing that's uncomfortable for you is the lack of control, right? The lack of understanding. Is that right? Okay, I'm going to just write it down and do this with you. Keep all of this down. I'm also going to say something about when you say that the media in America makes it look like it's worse than it is. Yes and no. Because if you're the house that got hit, it's as bad as it is. Or if you're the woman who was supposed to get married in October, the boyfriend who died last week, it's bad. Okay? So it's important to know how to relate in a real way with what's actually happening. Okay? Now, Rav Dessler says in his book, Striving for Truth, that the place of free will is like the edge of a knife. Yet we have free will, to a certain degree. Can't help but have it also be a rabbi, and I bring in spiritual things. In any event, the amount of control that we have over anything is extremely limited. Right? It's an opportunity. Are you having a hard time hearing me?
Yeah, you said something about being a rabbi.
I said I happen to also be a rabbi, and therefore I'm bringing in spiritual
That's what we
things.
couldn't hear.
Okay. So here's the thing.
Never hear anything.
Here's the thing. You're entitled as a human being to be able to hear what's going on.
Right.
Just a joke. Humor is very important. And I have to say it so I don't forget. The one thing I didn't put in my 45-page PowerPoint presentation, because I did it during the 3 weeks, is how important music is. And I left it out. I'm a musician, and I usually come with my guitar and do some music with you. But it's very important. Music is a real stress reducer. Getting back to control and entitlement. Okay? Control is a very... you don't have it, okay? But it's an opportunity for emunah. It's an opportunity for faith. Okay, so where you do have control, you do hishtadlut, you do what you can do. Where you don't have control, it's an opening for emunah. Okay? And I recommend to you that you don't focus on what you don't have control about. Focus on what you do have control about. And the most important thing that we have control about is our own inner experience. Okay? Your own inner experience. That's what you have control of. It's like you create, like Shlomo Carlebach Zatzal used to say, you have to taste Shabbat every day. Okay? So we're going to take a pause right now. Put your feet on the floor. That's right. Take a deep breath. You're entitled to breathe. Take a deep breath. If you want to close your eyes, you may. You don't have to. I'm going to close the door. Okay? Close your eyes. And just find yourself Erev Shabbat, Friday afternoon, before Adam and Chava were created. Find yourself in Gan Eden. Before there was ever a war, before there was ever even death or sickness. The beginning. And you can all be Adam HaRishon. The Kabbalah was male and female. And get ready to receive the first breath of life from God. And when you're ready, breathe that in. As a gift, a present that you didn't need to work for, you didn't need to earn, you didn't need to be good enough for, you didn't need to be giving enough for. Just God wants to give you life as a present in the Garden of Eden, where everything is wonderful. And we all know that there are multiple parallel universes, and you can choose to be in the one that suits your needs right now. And you can create that personal miklat. Not because there's anything bad outside, because there isn't. Everything is okay right now. And if you need to be concerned about that, which you don't, you can create your personal little closet, even if there were to be something outside that couldn't possibly reach you, because it's so far away and you're so well protected. Creating a biosphere where you have exactly the right temperature, the right lighting, perhaps the sounds of birds that you'd like to hear, or music that you'd like to hear, or your favorite colors, perhaps the fragrance of a rose or anything else that you would like to enjoy. And to allow each cell in your body that has a semi-permeable membrane which allows certain things to come in and certain things to go out, to let out the stress. Everybody knows that you can't put something in a cup that's full. So let out the stress and the fear from your cup, from every cell in your body, from all the neurons in your brain, from the lining of your stomach, from any place in your body that might have absorbed tension or fear. Let that place open and let the stress and the fear and the worry just drift out to make room for comfortable experiences to come in and be thoroughly absorbed into each cell of your heart, your digestive system, traveling through your bloodstream as you breathe in the breath of life that God has given you now, out of love and kindness, happiness of life. You can breathe into your lungs, be received into your heart, and spread throughout your body. Like the magic that it is. And be in Hayom Shekulo Shabbat, the perfect experience of Shabbat, in which you have everything that you need. There is nothing that you need to do but relax, receive goodness, enjoy that goodness, and continually learn how to do this deeper and deeper with each breath that you're breathing in comfort and with each breath that you're letting go of tension. As I say, if you pay attention, you don't need to have tension. Pay attention to what you need. Give yourself permission to give yourself and to receive what you need. Let the negative input from the outside be blocked. Allow yourself to remember what it's like to feel safe. Like it was when you were in that baby stroller, taking a nice nap and relaxing. Everything's fine. And let the muscles in your arms and your shoulders relax even more. Become aware as you scan your body from the inside, what organs, what limbs, what muscles can relax even more now. Enjoying learning how to have more control. Knowing inside your heart what you need and providing that with God's help and receiving it. And of course, in times like these, faith is important. Machshavotaya lo machshavotechem, says God. My thoughts aren't yours. And although we cannot understand the things that sometimes seem to be not okay, at the same time, every day we see miracles. We are living in biblical times of miracles. And each of us who made Aliyah found that strength to do something bold, brave, and you're entitled to give yourself extra comfort, because we all need extra comfort. So I'm going to count from 10 to 1. And if you want to, you can use each number to become more relaxed. Just to let yourself know. Perhaps a word that you'd like to utilize as an anchor, as a representation of comfort, calm, confidence. Perhaps inner peace. If you'd like to imagine that there's somebody who is alive, or used to be alive, that can be with you to comfort you now. Somebody who can give you a hug, a smile, a kind word, encouragement. All kinds of wonderful ways of becoming more comfortable. You have to let go. So take a deep breath, a cleansing breath, because we're all giving birth every moment. And again. That's right. And the more you breathe, the more oxygen your muscles have on a physiological level, you become more relaxed. When you breathe from your diaphragm, it changes the chemistry in your body and activates the parasympathetic nervous system, which increases relaxation and can also enhance the immune system. So do some deep diaphragmatic breathing from your stomach. Get back into that biosphere, private Modiin. You have your favorite things that help you to feel good. 9, 8, 7, letting your forehead relax. 6, letting your shoulders relax. 5, letting your legs relax. 4, your subconscious mind knows at least 3 ways that you can continue to go deeper and deeper into a state of wonderful relaxation. like you to consider doing, and it's only if you'd like to, is to, in a moment, or whenever it is that you'd like to open your eyes, to stay in this relaxed state with your eyes open. When you're ready, you can do that. Perhaps the room will look a little different. How are you? Yeah. Yeah? Did you go into your private mama? Yeah? I see a big smile. Huh? Yeah? Is it good? Whatever you want to, you can go there. How are you? Yeah. So it's very important. Let me just say a word about that, okay? Because, you know, I'm here since 2000, and I still am asking my wife, who is French, but she went to school here when she was in high school and has Hebrew better than I do. I'm watching the news. What does this mean? I'm hearing a lecture. Sometimes I don't understand what does that mean, and it's frustrating for me because words are my tools as a therapist and as a speaker. Okay?
Yeah.
So it's important to also have the opportunity to speak in English and not always be speaking in Hebrew. Now, there are people in Israel, lots of people in Israel, who don't speak a word of Hebrew, basically, and they function fine because they surround themselves with an English-speaking milieu. And you can do that. Now, it's important not to push yourself too hard. If you have a goal of doing Hebrew, that's what I work now in Hebrew, but when I first came here, I couldn't do hypnosis in Hebrew, now I do. But if I would be down on myself, pushing myself too hard on it, then I would have negative consequences instead of positive ones. So you need to find the balance. You need to not be hard on yourself for the things that are difficult, because there's not something wrong with you. If you took any of the people here and put them in New York or LA or London or wherever, they wouldn't be doing something. You have to find your niche that isn't frustrating and is rewarding for you. Because I know that I can't compete in language with Sabra. How can I? If I would even try to, I would only feel bummed out about it.
Yeah.
Right?
Sure.
Okay, so it's very, very important that you find experiences that you can have, the positive things that you can do, in a setting that is rewarding and comfortable for you. And there are plenty of them. Because there are lots of people who don't speak Hebrew in Israel, who speak English, who want help, who want connection. You just got together and made a support. So do that. You could say, I'd like to get together with a bunch of English-speaking people just to give each other support.
Sure, absolutely.
And you're smiling from ear to ear just with the thought of it. You haven't done it yet. You will, hopefully. Okay? And when I said you will, hopefully, you started laughing. You're smiling. It's the first time I saw you smiling today.
That's a good thing.
So it's good, right?
Absolutely.
So do it. Take a look about what we have over here. I need my kids to feel safe and to have peace and have no fear. Okay, let me talk about it. I need a break. Give me a minute, please. And I'm modeling for you right now what I said before. You have to have that awareness of where you're at and what you need, because if I didn't just do what I did now, I'd be burned out by the end of the day. You have to take a moment, take a step back. Where are you at? What do you need? And if a room full of people are waiting for you, but I need to relax for 30 seconds, I'm entitled. Okay, fear. If a person comes to me, Dr. Sheldon, I have a phobia of snakes. It would be inappropriate for me to hypnotize that person. And I don't hypnotize people, I help people go into hypnosis and utilize it. Okay? It would be inappropriate for me to have that person go into hypnosis and say, okay, I'm not afraid of snakes. That's stupid. It's like people afraid of bridges. Okay, I'm not afraid of bridges. So they go over a bridge, it's falling apart. They fall. Okay? So the idea of not having any fear is not smart. Because fear is something that protects us. And the difference between fear and phobia is it rational or irrational? Is it helping you, or is it getting you stuck and frozen? Okay? Because fight-flight response to a stressor, sometimes the thing is to run, and sometimes the thing is to freeze, because then the animal will leave you alone. But if a bear, you're supposed to make a lot of noise. You have to know what's the right response. And sometimes to be afraid, some people say, I'm not afraid, so they don't go into the shelter. And then they get done. That's not smart. Right? So if I came in and said, don't be afraid of anything, that's stupid. Be afraid in the right way. Meaning. And you know something? It doesn't even have to be fear. Because fear is really for people who don't think well. So they have to have that visceral fear response to motivate them. But if you're thinking in your right mind, you don't need to be afraid to go to a shelter. You say, okay, I don't need to be afraid. The right thing is to go to a shelter. I'm going to be fine. It's really important, what I just said. If you get to use your mind and your thinking in the right way, you don't need fear. You just took a breath when I said that. Take another one. That's right. So let's think about getting into that right mindset of thinking logically and rationally. And say, okay, I'm going to do that now. Simcha said something that's reasonable. Anybody thinking I'm wrong? You can say I'm wrong. If you think I'm wrong, you think I'm wrong? That's it. Okay. So let's decide, each one of us, we're not going to think rationally. We're going to do what's right and healthy and helpful. And I don't have to be afraid. And that fear that you had that's still residual going on, get rid of it. Do it. Shake it out. Shake out your fear. Everybody stand up. Stand up. Come on. Shake out the fear. Do it. Come on. Come on. Oh no, that's not enough. That's not enough. Come on. Hey. Huh? Embarrassed? Okay, everybody don't look at me, everybody close your eyes. Just shake. Shake, rattle, and roll. And breathe. Okay, I see 1 smile, 2 smiles, 3 smiles, 4 smiles, 5 smiles, almost a smile. Okay, now you're smiling. You're not smiling. Shake it.
The relaxation did ground us, because when I stood up, it's really good. You feel very grounded, and that's how I feel.
Great. You
feel very grounded. So
great.
That was a good.
Thank you for the positive feedback. Okay, you can stand or sit as you like. You don't like to stand. Okay, good. All right.
Really good.
Okay, so we lowered the fear. Did you lower your fear? You're a smart girl, right? And she's smart, right? She's quiet, but she's smart. Sometimes it's the smartest thing to do is to be quiet. It's my wife says to me all the time. Be quiet. Right? Correct. So we changed the no fear to appropriate fear if you need it, and if you think in the right way, you don't need to be afraid. That's positive, right? Okay. Now, personal one we did. Concern regarding your granddaughter. That's you. Right? Okay. Concern is a loving thing. Over-concern is a harmful thing. So help your granddaughter to make sure that she's doing things that protect her safety. And pray. Because that's better than being worried. Do what you can in a rational way to help her be protected. Make sure she is an homage, she has to get there. But then don't be concerned. Because, again, if you're using your mind in the right way, and you're taking the right precautions, that's why we have the mind. Right? Okay. I spoke about media. Better not to look at the news, okay? Really. You want to be connected to something that you're doing that's positive. Because to look at the negativity all the time gets in the way of being positive. Thank you. This is what I want to talk about, which is really important. Don't take personally other people's reactions or availability. Okay, this means as follows. If somebody's stressed out, the way that they might be dealing with it, or might be, there's reacting and responding. Responding is more like kind of outward intention, and reacting is more like automatic, okay? Let's say a person is just like really upset, or depressed, or anxious, or whatever it is, and that person deals with it by shutting down, by being quiet, by being unreal. And you feel what's going on. You connected to that, right?
Hmm?
You connected to what I just said?
Yeah, I was reminding her of
Okay. So some people close down, okay? And it's important not to take it personally. It's not easy to do. It's not easy to do. Okay? And there's a certain amount of responsibility on both sides. In other words, a person has to know how to not be too closed down if they need to be there with other people, for other people. But you also have to be understanding that everybody has their own defense mechanisms. So, if you're that person that's closed down and unavailable, it's important to tell the people around you, don't take it personally, I love you, but not much. And that's the way I deal with it when someone's. Now, your response might be, well, let me help you get out. And that person might say, no, that's not really me, I don't want to be. So if you actually, and here's where you have to really be clean and clear about it. Are you helping the other person get out for the other person, or you want to help the other person get out because you need contact with the other person? If you need contact with the other person's defense mechanism is to go inside, then what do you do? Well, there are a couple of things. One is you're not going to change somebody's personality in a moment. So it might be a good thing to find somebody else appropriate, very important, somebody else appropriate to connect with in an appropriate way. When I say appropriate, that means depending on how much of need you have, you can't be a leech on the other person. And also, you have to be careful in terms of levels of intimacy, because sometimes it happens in a couple or in a family when somebody can't really be there for you, you go looking elsewhere, and if you're going to the wrong place, it can create problems. So you have to be aware of that, even if it's a friend or if it's a boss or whoever it is. And it's a smart, loving thing to do, to say to the other person, I'd like to know if there's anything that I can do for you. What would be comforting for you? It might be a cup of tea. It might be a hug. It might be, do me a favor, don't ask anything of me for half an hour. Just might be in my own space. And just to notice what the other person needs. See if you can give it to them. On the other hand, it's important to let the other person know what you need. Because that helps relationships stay together. That was heavy, huh? Wow. That brought up a lot of stuff. I feel the energy in the room change from that topic. So let's breathe again. Take some deep breaths. There, good. Just smiling again. Good. Just smiling again. Okay. Because you know something? When you're holding, your knee quotient goes up. And the less abilities you feel that you have when you make it aliyah, whether it be language or work or self-esteem, making aliyah has a very big effect on people's self-esteem. Because a lot of the positive feedback that people got from all kinds of places isn't coming. Okay, so it's really, really important to be aware of that. And it's very, very important to find means of being able to receive positive feedback, because we all need it. This is very important, an important principle. Before you set out to do a task or to deal with difficult feelings, first things first, create a positive, internal, mind, body, emotional experience. And I would really add spiritual, but sometimes people in the audience don't like that, so I didn't. But now that I see who the audience is, I add spiritual. A positive, internal, mind, body, emotional, spiritual experience. And from that place, you'll be more effective and more efficient in doing what the task is. Okay. Everybody do this, okay? Close your eyes. And notice how your body is visible. Okay? Not how it looks in terms of aesthetic beauty, just how you feel inside. Okay? And do something to let your body feel more calm and relaxed. Might be uncrossing your arms, putting your feet on the floor.
Too short. I have to change chairs.
That's why I'm doing
You can discover how you feel with your arms folded and your arms down on your lap, and notice that you're using all kinds of muscles to keep your arms folded. That you're actually using less energy to be more relaxed. I've got it. I'm comfortable.
I know that's funny.
Okay, now. So that's body, mind. Okay, close your eyes again. Each person come up with a thought that is positive and comforting. A thought, a simple sentence about reality. Like what? I'm not in your head.
I know what's in your head.
Sit down, please. I'll do this. It's only fair, right? I notice tension here and in my jaw. So I'm letting my jaw relax, letting my head relax, letting my muscles relax, but my arms and legs get heavy. And in my mind I'm saying, I have the ability to cause myself to relax. That's a positive thought that I'm using right now. And I'm feeling the love in my family. It's helping me to feel comfortable emotionally. Even though there might be negative aspects to something, like everybody has negative aspects in their family, you can always find something that's positive. And God is with me. And as I experience that God is with me, it causes me an emotional response inside. Some sadness and letting go of that sadness, which is causing my body to be more physically relaxed, which in turn is causing my emotions to feel more relaxed, more confident, safer, which is causing my mind to say, I seem to do this more often. Which caused me to take a deep breath, which caused my stomach to become more relaxed. Which caused me to go deeper in my heart, to ask myself, what do I need? I need to feel more love right now. Get that I probably need to ask for that. I'm even going to ask, although it might be unusual, in fact it is unusual, that all of us in this room love each other. And me. And ourselves. Which helps me to feel less alone. Which causes me to feel stronger. Which makes me feel happier. That was my internal experience. I've never done that in front of people. But I think that, Israel is real, If you want to really be real, you have to go sometimes to that place. And it's a spiritually moving place. Because we're really here, I see when I look around the room, we're here for spiritual reasons. And it's an opportunity, when you do this work, it's really an opportunity to connect with God. When I say this work, I don't know what I'm doing, but all of us are doing. Because it says, Shmar v'nafshecha v'od. It's a mitzvah, the right time, the Torah, to take care of yourself. It's a way of connecting with God. So instead of feeling guilty and selfish, you can say, wow, I'm connecting with God, connecting with myself, connecting with other people. When you look around the room and see that Seldon Elokud, see the God, the image in everybody, and connect on that level, which is not an easy thing to do, most people don't. Most people are afraid to. But it's an opportunity. It's an opportunity. It's a whole other session to talk about how to deal with the spiritual issues, about what happened, and the 3 boys and everybody else. And I'd be willing to talk about that, but not now and here. And it's important that we do. 20,000 people in Haifa, 30,000 people in Yerushalayim for a Chayal Modiin. And what was said is in Israel there is no such thing as a Chayal Modiin. Okay. Relationships. It's very important to know what's happening between you and yourself, between you and others, professional relationships, and how to relate appropriately to the situation. That means orientation. How do you look at the whole thing, the bigger picture? I'm not going to go into the details because I have a lot to cover. And if you have any specific questions, you can ask me afterwards. We don't feel perhaps that we have the strength to understand how we can cope with war because it's a new thing for us. We don't have the experience or expertise in this area to call upon. That's what we're doing today. We're getting more experience and expertise in how to deal with it. Before, how do you deal with a war? Nobody taught us how do you deal with a war, right? I mean, the last war that I was part of in America was the Vietnam War. I dealt with it by protesting in Washington, D.C. I do not have reference points to know how I'm doing. See, I don't feel enough. I feel guilty when I'm fighting, etc. We don't have reference points. We don't have the experience to even know are we doing okay or not okay. And we tend to downgrade ourselves, which is not good. So it's important to find somebody, a friend or family member, who will say, wow, you're doing great. And if the person isn't doing great and they need some help, you're doing just fine, and I'm going to help you to lift up your spirits. Okay? I don't even know what I need to learn. This is so new, right? That's what we're doing today. I never needed to be a parent, spouse, friend, etc. in the middle of a war. Right? What's the right way of being a parent? What do I say to my kids? What do I say to my older parents? What do I say? Okay. What do I share with my children? Do I tell them what I'm really feeling or not? I heard a big sigh over here. It's an important issue. How do I help my children? How do I relate with my spouse and friends? Is it okay for me to ask for, give, or expect from myself and from others? And how do I deal with my fear and other emotions? Is it okay to ask? Because a lot of people are taught, don't ask for anything. It's supposed to be self-sufficient. You're not self-sufficient, you're not okay. Don't ask for anything. But we're in need. Everybody's in need of support. It's an important thing to get. Okay. Somebody asked, how do you create that positive mindset? Here are some things you can do. Okay, when you're doing guided imagery with yourself, you can utilize positive memories of the past. So you could be like in your favorite park or at the beach or in some wonderful experience. Use, very important in your life, good technology now. This is good technology. Use all of your senses to experience the positive experience. Okay? Sight, sound. You go into the beach, I hear the birds. I see the white on top of the waves. I smell the sea air. I feel the warmth of the sun on my face. I feel the comfort of my body on the sand. I can almost taste the salt in my mouth. Okay? Or you can create an experience. You know what I'm like? This guy broke his arm in freshman years ago, playing ball. I was waiting for the ambulance to come, he was screaming. So I said to him, why don't you put your arm on the moon and it won't hurt? That's what he did. Now, he was never on the moon, but he utilized the creation of an experience to feel better. Okay? We can do this. Okay, I'm going to keep on going. There's a positive side to stress, and that's motivation, but in the right amount. Okay? Identify and understanding high-risk and low-risk situations. It's very important to understand what kind of situations put you in a higher risk for stress. I'll tell you, you don't have to read it. It's better that I go over it. Because if you're reading it, you can't hear what I'm saying. So, I will go over it. Okay? What kinds of things? Here's an example, okay? This is good technical information to help you deal with what's going on. Okay? Identify what kind of situations are likely to create more stress, what kind of situations are likely to reduce stress. Okay? Now, you have between you and you. So, for instance, tell me something. If we're going to do body, mind, emotion, spirit. Okay? Body. What's a higher stress risk? Somebody tell me?
Heart.
Hmm?
Something with your heart.
No, physically. What could be happening in your body that would be more likely to increase your stress level?
Fear.
To watch the news.
In your body.
To watch the news all the time.
That's cognitive.
Sweating.
Sweating is a response to stress.
Sleep.
Lack of sleep, hungry, tired. Okay? Very important. You have to get sleep. But if you're hungry, you're more likely to be getting stressed, psychologically or emotionally, because if you're hungry, your body is physiologically stressed. That's between you and you. Okay? Now we're going to go to mind. What's a high? Okay. So hungry is higher risk of stress. What's lower in the body? Rested, fed well, not sugar highs. Caffeine, more caffeine. Let me take an energy drink. Not a good idea. Okay? Nicotine, all these drugs. Okay? Now, mind. What's a higher stress mind situation? Somebody want to say?
Negative thoughts.
Huh?
Negative thoughts.
Negative thoughts. Thinking too much. Obsessive thoughts. There's just something on the Modiin email list. Somebody gave a recommendation for treating OCD. Okay? If you're stuck in a loop, that's high risk. If you're not thinking at all, that also could be. You might think that if you're dissociating and you're not thinking that it's low risk because you're not dealing with anything. But on the other hand, it maintains the fear because you don't have rational thinking to let you know what's good to do. Now, stress between people. If you're arguing, right? Or if you have a lack of communication, that can increase stress. If you feel that you have support, that you have connection, that reduces stress. Okay? Personal behaviors that increase stress or reduce stress. Watching the news increases stress. Listening to some nice music decreases stress. Exercise is as good, according to all the studies, as antidepressant drugs. Just so you know.
Both photography.
Okay? Endorphins, you have to get your endorphins going. Okay?
What about fighting with your sister? What about fighting with your sister?
Right, well,
Confrontation.
that's what I said, is that arguments.
Yes. And then,
So you have to call me after the session. Let's straighten that out. Okay? Obviously, what can you do? Okay, what you can do is like this. I'll give you an answer, but I'll give you a number. Okay, one answer is like this. You could say, sister, I love you, you love me, you love each other, right?
It's not
Stop that.
I know, but I don't want to put them on the spot.
Oh, they love each other. Excuse me, that's what sisters do.
yeah.
Yeah, okay. That's a positive thought. Okay.
Yes, that's the whole point of Hypnosis.
Sorry.
Nice to meet you.
Nice meeting you.
You're welcome.
Thanks very much.
You're very, very good. Okay. So, you can call a truce. You can say, look, you know something? Right now, this is what Jews do, right? This is what New Yorkers do. Remember, in a blackout in New York, all of a sudden everybody's friendly with each other, right?
Mm-hmm.
You know, we're in a war. It's a time to not fight. There's enough fighting in Gaza. We don't have to fight at home. That's a good idea, right? And to know that the truth is that you love each other. Even though sometimes you fight and can't stand each other. Okay? But you know something? Even if you don't love each other, it's not really rocking with each other. Life's tough enough. Okay? But you know something? You guys can say, look, I know you can do something for me that'll make me happy. And I know that it goes in both directions. So see if you can create a partnership. And we can talk about that. Beyond that, I gave you some quick answers. Intimate relations can be a stress reducer. And it's important to know how to deal with that because sometimes people under stress, they want their space. So it's something to look at and be aware of. That's the important thing is of being aware so that you can then have a relationship to it and take responsibility. Okay. There are all kinds of stress symptoms that people get. It could be headaches, it could be stomach aches, it could be IBS, it could be herpes, it could be all kinds of different things, psychological, emotional, cognitive, all kinds of things of stress. Okay? I wanted to talk about that more today, but we started late because we didn't have the bar call, and we did a lot of personal issues to share. It's important that if you're having any kind of physiological, emotional, or cognitive, or even spiritual symptoms, you might not realize that it's related to stress. So it's important to figure out, if what you're experiencing has to do with stress, and there are very good ways of reducing it, okay? Obviously, I really like hypnosis and learning self-hypnosis. It's a great stress reducer. Yoga, biofeedback, therapeutic horseback riding, cartoons, music.
Massage.
Massage.
My wife does medical massage and healing.
That's great.
And by the way, she's done something amazing during this war. If anybody knows, she only works with women, that if you know somebody, a woman who has either a child or a husband in Gaza, free massage. Okay? So if you're having some kind of symptom, do something about it. Close your eyes and open. and appreciate yourself in coming today. Just appreciate yourself for being alive. Appreciate life and God, for being alive, for being healthy, for being here. I sincerely hope that I provided for you things that are good for you. Take them home with you. Spread them around. Share them. Be loving to yourselves. Be loving with each other. Bless us all that we should have an everlasting peace. And know that what we're going through now comes with Tovah. And to be blessed to be able to see the good in everything that's happening. And with those things that we can't understand, don't get stuck. Focus on the positive. Focus on the positive. And remember to create every hour. Ask yourself, I need now to create a positive, healing, mind, body, emotional, spirit experience. It will only be good for you and the people around you. Thank you very much for coming.